Good morning, this is Dr. Dumestri, double board certified plastic surgeon, and today I'm starting off by doing a breast implant removal, immediate lift, and fat grafting with an auto augment flap, and I wanted to show you a diagram of what that looks like. This patient had saline implants that were placed in 1999. She always felt like they were too big for her and was just wanting to be smaller, wanting not to have anything in her anymore. I first did an in-office deflation for her back in November, little poke hole at the base of the breast, no freezing, nothing required. Drained all the saline out. She's now had a couple of months for that skin to tighten and lift, but she still does have quite a bit of extra skin, wants everything reshaped. So when we look at this diagram here, this is basically the starting breast. So it's sitting kind of long on the chest wall. So when you imagine it from a side view, it's a little bit longer. The areola, the first step that I do is downsize it. So that's going to be that new mark here. Then I decide, okay, I want the new nipple position to be higher. I end up making this type of design when I first see you, and I remove the skin layer from around this. Your nipple and areola stay attached to all of your breast gland, all of the undersurface layer of skin this entire time. After I'm done downsizing that areola, I then access your implant through making the upper border of what will be your auto augment, which I'll explain in just a moment. So I dissect down, I find the implant capsule or the scar tissue that was around her old implant, and I'll pull out this now deflated implant sac. Next, I'm going to remove the outer layer of skin from this bottom portion of the breast. We don't want to lose any volume, so I don't want to lose any of her actual breast gland, so I just remove a very thin layer of skin. This now gets tucked in under the breast, almost like a very mini implant. Next, all of these limbs are going to cinch together to form the new shape of the breast. So when we look at this diagram in comparison, the same amount of breast volume is now tucked into a much smaller shape. This red represents where this lower area has been tucked in to give her extra shape and volume, especially at the top of her breast. And then the last thing that I'm going to do is a little bit of liposuction to her low back, remove some liquid fat, clean it, and then repurpose it to, again, thicken up her areas of deflation to the top of the breast to give her a little bit more volume. So that's now represented everywhere I inject the fat up into the skin envelope, focusing to the upper part of the breast, but I do end up putting some a little bit everywhere. So when we look at the final scar pattern, we have this anchor-shaped incision. She'll have an incision that goes underneath the breast too. When you look at the side view, this is the goal of the reshaping. Ultimately, she'll have a nice natural looking breast, nipples sitting in a perky position. Still, a lot of the breast gland is sitting in a natural position at the base of the breast and has got kind of that nice perky shape and look. That is the day today, followed by a nice little tummy tuck. Have a great day.